Welcome to the Business Talk, a global podcast series that highlights distinguished faculty members and their impactful scholarly contributions. I am Deepak, your host from India. We are honored to welcome Dr. Gary Young as our distinguished guest for today's episode. Before we get started, I would like to introduce today's guest. Professor Gary Young stands at a rare intersection, part scholar, part policymaker, part legal strategist, bringing a multidimensional lens to one of the most complex sectors in modern society, and that is healthcare. As director of the Northeastern University Center for Health Policy and Healthcare Research and professor of strategic management and healthcare systems, Dr. Gary has spent his career asking the hard questions about how healthcare is delivered, managed, and governed. His journey to academia wound through the corridors of federal government, where he practiced as a healthcare attorney and through the strategic advisory world of national healthcare consulting, giving him a practitioner's instinct that sharpened his scholarly work. Before Northeastern, he chaired the Department of Health Policy and Management at Boston University, a role that reflects the trust the academic community places in his leadership. His research spanning managerial, policy, and legal dimensions of healthcare delivery has earned space in some of the most prestigious venues in both medicine and management, including the New England Journal of Medicine, Academy of Management Journal, Strategic Management Journal, and Health Affairs. That work has attracted funding from an impressive roster of agencies: the National Science Foundation, the CDC, the Department of Veterinary Affairs, the Agency for Healthcare Research and Quality, and the Robert Wood Johnson Foundation, among others. Recognition has followed, including John D. Thompson Prize for Young Investigators from the Association of University Programs in Healthcare Administration. Perhaps most telling, Dr. Gary Young is the kind of scholar policymakers call when decisions matter. Having served on national committees for the IRS, National Academies of Science, Engineering and Medicine, Department of Veterinary Affairs, and even the Department of Homeland Security, his voice carries well beyond the lecture hall. What does the future of the healthcare workforce really look like? In today's episode, Dr. Gary Young joins us to explore the bold ideas behind his acclaimed book, The Healthcare Professional Workforce: Understanding Human Capital in a Changing Industry. Let's not keep you waiting. Please join me in welcoming Dr. Gary Young to the conversation. Professor Gary, it's a distinct privilege to welcome you to Business Talk. We are grateful to you for accepting our invitation.
Thanks, Deepak. Very glad to be here.
Thank you.
Appreciate the introduction.
Thank you, Professor. Professor, your book has been described as the first of its kind to codify transformations across the US health professions. What was the defining moment or gap in literature that compelled you and your co-authors to take on a project of this scale?
Yeah, well, we were at the time that we really were thinking through the idea for the book, we were really witnessing significant change in the healthcare professional workforce, both in terms of the expanded clinical role of certain healthcare professionals, namely nurse practitioners, physician assistants, and pharmacists, but also the relationship between healthcare professionals and healthcare delivery organizations, particularly for physicians. So really a period of great change in the health professional workforce, and we wanted to examine these developments and consider their implications for the U.S. healthcare industry. Really a remarkable, it's not a single point of inflection, certainly, but critical developments that were occurring during that time and continue into today, and really transforming, the way the U.S. healthcare industry is organized and managed.
Professor, Chapter 2 provocatively declares that medicine is not your parents' profession. In your view, what is the single most disruptive force that has fundamentally changed what it meant to be a physician in today's healthcare system? And is that a loss, a gain, or both?
Yeah, well, certainly one can point to the growing corporate presence in medicine as a highly distinctive force. There's a diminishing independent physician sector in the U.S. Most physicians today work as employees for hospitals, private equity firms, or other types of corporate entities like health insurance companies. But this is a major shift. In a period of about 15 years, the percentage of physicians employed by hospitals, healthcare systems has gone from 20% to well over 50%. And the independent physician sector has really been a key feature of the US healthcare industry, and it's now disappearing. So this is certainly a major change and disruptive in the sense that it has serious implications for the working lives of physicians and potentially for patient care. But really, I might refer to a development that's even more disruptive, if not as clearly defined. And this is the demystification, if you will, of medicine itself. As sociologists have long noted, a key source of the prestige and influence of physicians has been that much of what they did to and for patients was not understood very well by patients, by the public. Physicians have had this furtive knowledge, this magic. Patient outcomes were not very transparent. They were in a sense secular priests. But this magic, if you will, has been exposed through various channels of information to the public. The internet, public report cards on providers' quality of care, performance evaluations of providers based on explicit quality metrics, standardization of patient care through clinical guidelines, value-based reimbursement, and now certainly AI, artificial intelligence. And so patients increasingly see their physicians much like any other service professionals with whom they enter into a commercial transactional relationship. And so medicine, yes, is not your parents' profession anymore. You know, when I was a kid, my parents would bring me to a pediatrician, for example. There'd be, long wait times. Many people sitting in the waiting room, and we would wait and we would wait and we'd wait. And my parents would tell me that's because this physician is so good that people will wait and wait and wait. That, for my parents, was sort of an indication of how good the physician was because you were waiting well past your scheduled appointment time. Today, we don't tolerate that. We get upset when we are not seen on time. We think about, again, medicine, patient care in more transactional terms than we used to. And so, yes, it's not our parents' profession anymore.
Professor, the book dedicates significant attention to the transformation of nurse practitioners, physician assistants, and pharmacists. How do you see the evolving scope of practice for these professionals, reshaping the traditional hierarchy within care delivery? And where do you think the boundaries will settle?
Hmm. Yeah, well, I certainly see nurse practitioners and physician assistants continuing to pursue greater clinical independence from physicians and expand their scopes of practice. I think this is in line with the sort of historical pattern for professional groups generally, and the same may be true for pharmacists as well. I think the public has become and will increasingly become accepting of these healthcare professionals to perform clinical activities that were really once the sole province of physicians. Nurse practitioners have really taken very big steps in that direction. This means that healthcare professionals have to learn to compete as well as collaborate with each other as previously defined professional boundaries overlap somewhat. For such professionals, how much they compete versus collaborate may depend on where they work, their clinical setting, their clinical roles and responsibilities. But I do think that, some of the healthcare professional types that we talk about in the book, again, nurse practitioners, physician assistants, will continue to expand their clinical independence and their scopes of practice in ways that will blur previously existing boundaries between what they do and particularly what physicians do. And I think that again means that we're going to see more competition among these professional groups. But at the same time, we have healthcare organizations that bring these professionals together. And so they're going to also have to learn to collaborate if we want to see them contributing effectively to good patient care.
Professor co-authored the chapter on health professionals and organizations moving toward true symbiosis. What does that symbiosis actually look like in practice? And honestly, how far are the most health systems from achieving it today?
Yeah, great question. Because as I mentioned before, we're seeing this shrinking of the independent physician sector. That's really a key development in the U.S. healthcare industry. As I said, most physicians today are working for some type of corporation rather than working for themselves, or for an organization that is owned and controlled by physicians. As for symbiosis, well, still very much, I think, a work in progress. So, my research team and I recently completed a study of hospital acquisitions of physician practices. And some of what we heard from both health system leaders and physicians who've been part of the acquisition process, um, we hear, points of conflict that really are the same ones that have been raised since the 1990s, when we had sort of a spate of hospital acquisitions of physician practices, particularly primary care. There continues to be disputes over productivity of employed physicians' concerns about limited autonomy, or they feel that their autonomy has been limited since they've transitioned from independent practice um, to employment arrangements. Um, and disputes over investments in how much support staff clinicians need, investments in clinical technology that some clinicians feel are not adequate. So we continue to see these points of conflict. So you ask about symbiosis, and I would say that, as far as the increasing integration of physicians and healthcare delivery organizations, hospital systems, it's by no means at or near its final chapter. The story continues to unfold. We continue to have issues with misaligned incentives, disagreements about common goals, still not sufficient mutual understanding of each group's priorities and perspectives. And so, yes, symbiosis has not yet been achieved. Hopefully, we're moving in that direction. I will say some are skeptical. The fact that we continue to hear some of the same points of conflict that we've heard for decades, can make one a little bit skeptical. But I believe that as we see more integration of hospitals and healthcare professionals, namely physicians, some of these issues will ultimately be resolved, will be worked out as each group has a better understanding of the other. And my hope is that we may never have perfect symbiosis, but we'll be moving in that direction.
Professor, the book addresses the paradoxes of leading and managing healthcare professionals. What makes healthcare professionals uniquely difficult or uniquely rewarding to lead compared to talent in other industries from a strategic management standpoint?
Yeah, well, there are important differences that make it more challenging to manage healthcare professionals versus, other types of professionals that are in other corporate sectors, they're in other sectors of the economy. Namely, is because healthcare professionals have very strong connections to their professional communities. Their professional identity really transcends their organizational identity. So, you see this sometimes in television medical shows where physicians will make decisions that they think is in keeping with their professional values, even though it contradicts the policy of the organization they work for. And this is sometimes presented as in somewhat heroic terms for professionals or healthcare professionals. So this brings us back to points about symbiosis, professionals and organizations, and that delicate balance that needs to be managed. Um, but it's more difficult to manage healthcare professionals. As far as rewarding, there's optimism among healthcare experts and policymakers that if we can integrate physicians and healthcare professionals effectively, there's a big payoff for better patient care, better care coordination, better continuity of care, fewer medical errors. In the US, healthcare has been very fragmented. One physician will refer a patient to another physician, a specialist, but will ultimately lack information on what was done for that patient, what the results were for additional diagnostic tests. And so there's a hope that by integrating professionals into healthcare organizations and being able to manage them effectively, we may actually get less fragmented care, that will be the big payoff. But it is more challenging for healthcare organizations to manage healthcare professionals. One has to recognize their strong professional identity. You cannot subvert that. You need to embrace it and figure out a way to manage effectively with respect to that strong professional identity.
Professor, the book frames healthcare professionals explicitly as a human capital in a changing industry. How do you reconcile the business imperative of cost efficiency with the very human reality that these are caregivers whose satisfaction, autonomy, and well-being directly affect patient outcomes?
Yeah, well, this question brings us back to the point about healthcare professionals having strong professional identities that can put them at odds with, corporate goals and also public policy goals. A familiar narrative for the public is often presented by the media, is that the goals of healthcare corporations is to make money, whether that's by doing less care or by doing more care, but the focus is on making money, and that this can conflict with patient care goals that healthcare professionals are trained to prioritize. But I will say delivering patient care efficiently is really a goal that all stakeholders in the US healthcare system need to unite around because our system is very, very expensive. So much more so than, any other country in the world. And it is not, as they say, sustainable, at least not without crowding out other important societal needs, education, transportation, infrastructure, et cetera. So there needs to be clear attention to cost-effective patient care, but in a way that is in line with good patient care and again is respectful of the values, the professional prerogatives, the ethos of healthcare professionals. We need well-considered policies for patient care that are informed by healthcare professionals. I certainly don't think that there is an inherent conflict between cost-effective care and good patient care. But as a society, we need to make at times some difficult choices about what we're willing to pay for in terms of care, including expensive medicines. We are seeing more and more expensive medicines coming through pipelines that may add some degree of um, quality of life for patients or extended lifespan, longevity, but they may come at a huge cost, and we have to think about some of the trade-offs that those medicines entail. We need to think about where responsibility rests for people's patient health status, and we also have to think about how we pay for healthcare services. In the U.S., we've been moving away from fee-for-service payment toward more value-based reimbursement. It's occurring slowly, but we need to think more carefully about how we're paying healthcare providers. Are we paying them in the right way to, achieve cost-effective care and also good patient care? So these are important considerations. But we need to, as I said, we need to be respectful of the fact that healthcare professionals have important values that come from their own professional training, and we need to be respectful of that, and we need to think about how that becomes not an obstacle to cost-effective care, but a motivator for healthcare professionals to achieve cost-effective care.
Professor, Chapter 6 tackles how professional training will and should change. What is the most outdated assumption still baked into medical and health professional education today? And what would a truly 21st century training model look like?
Well, I think at least until recently, professional training not sufficiently recognize that patient care needs to be delivered or managed in team settings. Training tended to focus a great deal on the health professional, the healthcare professional in a somewhat, individualistic way. So not enough attention to issues of care coordination, communication, and that is sort of how professionals need to be able to communicate interprofessionally, care continuity, um, more attention to that in terms of theory and principles. I think we are beginning to see training programs move in that direction, but maybe somewhat slowly. I think nurse training has probably been more progressive in that respect than perhaps training of other types of healthcare professionals. Certainly, professionals learn, some of this on the job in terms of how to communicate, care coordination, when they continue their training outside the classroom into clinical settings. But earlier preparation is important also. Um, so I think that's something that needs to really be given a great deal of attention. And again, as I mentioned, I think we're beginning to see that, maybe not moving quite as quickly as some would like. Um, Also, I think training for all professionals has been moving from sort of an exclusive focus on treating disease to more attention on prevention, engaging patients in their own care. So I think that's an important development. Medical schools, I know, are also taking steps to integrate the basic sciences and clinical care, so they're not really taught um, really in a siloed way. Um, so I think there's a lot of progress in how we're, training our healthcare professionals. I think for physicians, there's been more reconsideration of sort of standard ideas of residency training, the grueling hours, the menial tasks that really don't have much to do with training and educating good doctors, more about maybe inexpensive labor for hospitals. So some of this is changing also and for the better. So I think that there's a number of different steps that are going on in training programs to try to embrace some of the important goals, features that we're going to need to, going back to your earlier question, provide good, effective patient care to deal with some of those potential boundary conflicts that I mentioned among different types of professional groups, healthcare professionals. And so I think that I don't think I could articulate a ideal training system, but I think that we are taking some steps that are really improving the way we are training and educating healthcare professionals.
Professor, given your extensive work on national level policy committees, including those for the National Academies and the Department of Veterans Affairs, where do you feel policymakers are most misaligned with the on the ground realities of the healthcare workforce?
Hmm. I think at times there can be, from my own experience, I think at times there can be a sort of a knee-jerk reaction by policymakers to certain health policy issues, whether it's high cost of care, quality problems, where you're sort of looking for culprits to demonize certain healthcare professionals and the healthcare organizations that employ them. Um, and there are demons. I mean, we do have to worry about fraud and abuse and some other types of misdeeds that can certainly drive up healthcare costs, undermine quality of care, that really, negatively affect our ability to deliver good, cost-effective healthcare. But, most healthcare professionals are dedicated people trying to do a good job in a very, very challenging environment where there's often some mixed messages about what is the right thing to do for patients. We change the rules sometimes. We don't often clearly define certain rules. And so I think that sometimes policymakers, again, trying to do the right thing, but they kind of overlook that most of the people working in healthcare the healthcare professionals are really dedicated, very dedicated people trying to do what's right for patient care. But again, there's some conflicting incentives in the system. There's at times rules that are not clearly defined, or we're changing the rules in ways that can create confusing messages to healthcare professionals. And so I think policymakers need sometimes to be a little more sensitive to that reality.
Professor, the book argues that team-based care, where physicians, nurses, pharmacists, and others collaborate, is the emerging model. What cultural and structural barriers most persistently get in the way of that collaboration, even in institutions that claim to have embraced it?
Well, yeah, there are certainly cultural differences among some of the healthcare professionals in terms of how they think about good patient care. There's some institutional issues that have to do sometimes with how scopes of practice are defined, implemented. Um, as we've discussed, there's increasingly a need for professionals to both compete and collaborate. I think that also is an important sort of development where in the past, there were fewer contested boundaries around what one healthcare professional would do versus another. I think those boundaries, as I said, are becoming a bit more overlapping and so more contested. And that means, some degree of competition. Some would say that's great. That means more choices for patients. Where do I want to get my care? What type of healthcare professional best meets my needs? So more choices. But at the same time, we're also trying to build healthcare delivery organizations that bring these professionals together to better coordinate care, um, find ways to provide patients with a more complete, um, you know, care opportunity. And this means this, again, we're in the situation where we're asking them to both compete and collaborate, and that's always a difficult balance. I think for organizations that employ these professionals, there are challenges to managing them, as we discussed. Um, and their distinctive professional identities, their ambition, their turf battles. We don't want that to impede good patient care. I don't think there's any secret sauce here. I mean, we need good management that can secure trust from professionals and set up clearly defined policies and expectations for how care coordination will be achieved. And again, strike that delicate balance between sort of competition and collaboration, sometimes even within, the same healthcare organization. But um, finding that balance is going to be very important for being able to, provide the type of care that, we want patients to have.
Professor Gary, I would like to conclude this episode with one last question. If you were to write a sequel to this book today, what new chapter would you add? And what transformation in the healthcare workforce has accelerated or emerged since the book's publication that you believe deserve urgently for scholars and policy matters?
Yeah. Well, certainly if we were writing it today, AI would have to figure in pretty prominently. Now, I don't know whether that's a distinct chapter or whether it's being weaved in to many of the chapters in the book, but AI would have to figure in prominently. AI is having and will have, of course, an important impact on medicine as it is on every other sector of the economy. But I think certainly if we were writing the book today, we would have to give serious thought to what it means in terms of, the healthcare professional workforce. Does it actually replace certain types of professionals? Does it, you know, how does it sort of change some of the scopes of practice that I mentioned before? Certainly AI is being used very extensively within the healthcare industry on administrative tasks, but also certainly clinical as well. And there's a lot of discussion and thought about, whether, certain types of healthcare professionals, the need for those professionals will decline, or whether they're, again, sort of the nature of their work, the scopes of practice will be dramatically revised. So I think, yes, if we were writing the book today, that book was written really before we had sort of this explosion of AI capabilities, and so that would be I think the addition to the book.
Professor Gary Young, the conversation has been a masterclass in understanding the human side of healthcare, the people who power it, the system that shape them, and the policies that must evolve to serve them better. Thank you for bringing such clarity, depth, and genuine passion to these issues. For our listeners, I hope today's discussion leaves you thinking differently about every healthcare professional you encounter. Until next time, take care. Thank you, Professor Gary, for so generously sharing your time and this fascinating work with our audience. It has been a truly enlightening conversation. Thank you so much.
Thank you, Deepak. Really enjoyed the opportunity to talk with you.